Hello, guys. Many people ask me about the side effect of Zepbound and Wegovy. They want to compare it. I'm gonna explain them with a table. I have a really great table to share here. The thing is, I have to open it. Allow me 1 second, please. So I will just move it. I'm pulling up the table that includes very detailed, like the percentage of the side effect that may happen. I'm gonna enlarge it. So here, okay, there you go. So these are the side effects, common side effects of the Wegovy and Zepbound, and we compare them. You see terzepatide and semaglutide. Terzepatide equals Zepbound, Monjaro as well, and semaglutide is Wegovy or Ozempic. And the most common side effect is nausea. About 43.6% of people experience nausea. I hope I could somehow use a pen somewhere, but I can't. So I would just explain them. And there's no like a gap between Zepbound and Wegovy in nausea standpoint. 43.6% and 44%, both of them about 44 people out of 100. I want you to understand the chance that somebody experience so severe nausea and they ends up stopping the medicine because of this side effect isn't that oh, you can see the mouse, right? Oh, perfect. Okay, so mouse cursor is here. You see people, only about 1.3, 1.9 out of 100 people stop using Wegovy or Zepbound because of nausea. Majority of the time, in about a month, the significant nausea disappears, and many of them say it's completely gone. It may stay there like a couple of hours after injection, but typically it doesn't last long. Let me just make sure there's no other patient waiting for me. Okay, nobody's waiting for me. Let me continue. And let's see. Here, oh, I'm sorry. I have only one. The screen here, so I'm kind of searching for. Yeah, there you go. And next common side effect is constipation. Yes, constipation happens often. I do have a video in my channel. Let me just bring the studio. Let me bring the link so anybody can watch it in case you need it. Constipation. I'm searching in my channel now. I'm gonna bring. Okay, there you go. And where should I? Okay, I'm searching for ways to kind of share it with everybody. Here, okay. Okay, I'm gonna show the comment on the stage, and let me just post it again. Is it gonna appear? Yeah, there you go. I hope you can click it. I hope so. Let me just double check if you can actually click it by checking the live stream as a viewer. Let me see. Okay, it appeared on there, but you can't really click it, right? All right. I would just bring a title of it so you can constipation. Okay, constipation, and this is it. And let me just put it in here. No, I don't have to put it in here. Let me just introduce you then by sharing another screen, stop screen, and I'm gonna share this screen. Okay, there you go. So this is the video in my channel, how to manage constipation on Zepbound or Wegovy. I explained the amount of water you need and how to tell you if you are getting enough water or not, and how much fiber, and and what's next, over the counter, and if the over the counter doesn't work, what else? So you can go ahead and watch this. Let me just change the. Oh, I didn't even. Oh, I'm so sorry. Let me just share it again. This is it. Let me see. I didn't even show it to you. There you go. This is the video that I explained about how to control the constipation while using the Zepbound. You can watch. And let me just move back to the table. Share it. Can I just add an image here? Oh, I can share. I will just save this and then share it, image file, and there you go. Let me see what it looks like here. Add to the screen. All right, you can see it now, but I think a screen share was better. Let me just share the screen. That was better. There you go. All righty, so next. Is it? This one. I remove it and put it. Okay, so the third common side effect is diarrhea. Diarrhea happens less than constipation. My personal experience is I have seen much less diarrhea compared to constipation. Probably because it doesn't bother as much as constipation, and people just decide not to tell me. Or the other possible potential explanation is maybe it resolves sooner than constipation. So by the time they see me, because our patients see me once a month, so by the time they see me, maybe diarrhea is gone. But constipation, clearly constipation bothers more than diarrhea. The fourth side effect is vomiting. Of course, I mean, nausea and vomiting. You can just see this as a more severe form of nausea. I'm just double checking. Nobody's waiting for me. And so vomiting. But again, people who ends up stopping the medicine because of this vomiting is no more than like maybe 1.1% with the Wegovy, but 0.8%, which is 8 out of 1,000 people with the Zepbound. Coronavirus, I think it depends on your exposure and the way how you protect yourself. So I'm going to bypass this. And feeling fatigue, you may feel like, hey, feeling tired. I mean, that's not a big deal if I can lose 30, 40, like a 30, 40 pounds. But the tiredness here is somewhat like the way more than what you normally experience. People really feel tired, and we don't have clear like like an explanation of why, what mechanism. Even though I mean we have like a more like general explanation on like a diet change and like maybe hydration status change, things like that. But still, the scientists and doctors are coming up with all the theories like how the Zepbound and Wegovy can affect the mitochondria or blah blah. We don't know yet, but this tiredness really changed our plan. To be honest, you can see that people who stopped using the fatigue, these medicine, it was only one among 287, 297 patients on the Wegovy, Zepbound and Wegovy each. So it's rare. It's there, but oftentimes we, instead of stopping the medicine, we end up checking your cell count and chemistry and like electrolyte balance, kidney function, liver function. And if you're taking thyroid medicine, we also check the thyroid level as well and make sure there's nothing crazy happening there, and continue it. Irritation, like many people tell me about like they are burping. We often try like a low FODMAP diet, which is these are the foods that causes more like a gas and burping, and by avoiding them we can improve this the thing is, you shouldn't be doing that by yourself because extreme low FODMAP diet may lead to some nutrition deficiency. So you must follow the nutritionist guideline. And of course, we have great nutritionists in our team who can help you with that. Injection site reaction is this happens, and this is interesting that it rarely happens with the Wegovy, but it almost always happens with the Zepbound. This is consistent with my experience as well. It typically happens with the Zepbound. One other thing to remember is injection site reaction. Many providers take it as just like a localized reaction. Don't take it too serious. Maybe some just localized contact dermatitis or your body's reaction to the new chemical. And it does get better with hydrocortisone cream, like a topical steroid cream. The thing is, we had one case that who had this injection site reaction, and then we continued the medicine without stopping with hydrocortisone cream, but it ended up spreading to general, and he had a facial swelling, tongue swelling, things like that. So whenever this happens, whenever I feel like, oh, it's getting worse, it's progressing, I have EpiPen and prednisone ready. But I wouldn't necessarily say when you see an injection site reaction and say, oh, it could be anaphylaxis and you should stop it immediately. I wouldn't say that. I would just keep a close eye on and be prepared for the worst scenario, which is less likely to happen. This is how we proceed. And upper respiratory infection, again, just like the coronavirus, I think this is also related to how you control the infection, but so I will bypass. Alopecia is very important. This is, anyone can understand this, and especially for for there are certain population who pays more attention, who this matters more to them. And alopecia, like when you lose hair, what we do here is there are certain list of like a nutrition that's related to this. I have this here. Let me show you. Hair loss. I'm finding hair. Okay, there you go. And this is the copy. This is the video we have. Is your hair falling out because of these hidden nutrition deficiencies? I explained the details in here, and also I explained about. Oh, no, never. I'm bringing the video here. And this is another video how we approach the hair loss, especially for female patients. So we initially check the nutrition deficiency, if there's any nutrition deficiency. And if there's none, then we approach as just general hair loss. But almost maybe more than half of the time, we find some nutrition deficiencies. Like common ones are zinc or iron or vitamin B7, vitamin B12, folate. Sometimes thyroid dysfunction also causes it. And what else? Yeah, these are the common reasons for someone to have a hair loss. And it's very easy to correct them. And many times people tell me, yeah, hair loss is gone or it's much better. Abdomen distension and headache, abdomen pain, they also happen. And dizziness, I will just explain the dizziness as the last one. I have somebody waiting. So the dizziness is, it often happens because of more like hydration status. So there's no like really direct relation between some nerve damage or a heart problem that's caused by the Zepbound or Wegovy to cause the dizziness. It's more like people feel dizzy when they stand up quickly. You have to know that almost half of the water intake a day comes from the food. So when the food amount goes down, like a portion size goes down and appetite goes down, it automatically leads to like a decrease in water intake. In addition, the Zepbound and Wegovy decrease the thirstiness as well. So people tend to drink less water together. And in addition, as they lose weight, of course, the resistance that's been applied to the venous system goes down. So altogether, like less blood circulating blood volume, dehydration, and then larger blood volume capacity, maybe lower resistance, all leads together to the dizziness. Very common. So it's very important to fully hydrate. And I often talk about, I mean, I have another video in my channel. You can see like how much water is appropriate. You can see that, but one of the easiest way, very rough, but easiest way to tell whether you are well hydrated or not is checking your urine color. If your urine is very thick yellow, try to make it as close as possible to crystal clear urine. That's a good way. And almost always, people feel better with a better hydration. Sometimes we slow down the up titrate because of this tool. That's one other good strategy. And here, let me just add just one more, reflux. Unfortunately, many times people, when they come to us, the obesity, weight gain, and the visceral fat increase in the intra-abdominal pressure itself is a cause for the reflux. So many times people already have this problem and they are on some medicine for that, like omeprazole, pantoprazole, or Pepcid. And because of the Zepbound and Wegovy's effect on your digestive system, oftentimes it gets worse at the beginning. And we, in that case, we often increase the omeprazole dose if somebody is already on, or start the omeprazole, knowing that it's gonna get better soon. So as people lose weight and then intra-abdominal pressure goes down, and also your body, your digestive system get used to the new medicine, and then oftentimes it gets better. And after 1 or 2 months after we increase or start the omeprazole, we taper it down and see how they do. And many times this side effect disappear. So I think those are the most common most important side effects I want to comment on, and there are more like a dyspepsia, decreased severe, not like just, I mean, decreased appetite is what we wanted, but severe suppression in the appetite and some sinusitis. Yeah, it may happen. Overall, the chance that somebody stopped the medication because of some significant adverse side effect isn't that high. About 6% with the Zepbound and 8% with the Wegovy. And among them, 2.7% is GI digestive system related, and 5.6% is Wegovy related. So that's pretty much about it. Thank you. It's been 18-minute live, and I'm gonna repeat it on and on. So whenever you want, you want to watch it again, you have some question, I will open it again, and we can always discuss in the future.